Hello everyone, in this video I'm going to talk about the pain, mechanism of the pain, type of the pain, pathophysiology of the pain, and some effect and some factor that influencing the pain sensation. Okay, so first of all, let's go and talk about the pain. The pain is unpleasant sensory and emotional experience associated with the potential tissue damage. So, it is often initiated by the external or internal noxious stimuli, universally considered as a signal of disease or disorder. So, the pain is happening because of the burning, pricking, beating, or biting, or cuts, or wounds, or any surgery or accidents. There the major thing we want to talk about the type of the pain. Depending on the onset of the duration of the pain, maybe is acute or chronic. So, the first of all, chronic pain. The chronic pain is a pain that typically produced by the sudden injury or fracture or illness, is a cut is the acute pain, and usually is a warning signal and resolves quickly. So, like a headache or joint pain or backache or toothache. So, the second type of the pain is the chronic pain. The chronic pain is characterized by the gradual onset and long-lasting discomfort with the like injury, like some arthritis or malignancy or kidney stone. Symptoms of the chronic pain are increased heart rate or increased blood pressure, so sometimes leading to sweating. So the second important part I want to discuss with you is the pathophysiology of pathophysiological classification of the pain. So we have nociceptive pain first, second we have neuropathic pain, third we have inflammatory pain. So nociceptive pain is a represent the normal response to noxious injury of tissue. Second, neuropathic pain. Neuropathic pain is a pain initiated or caused by the primary lesion in the somatosensory nervous system. Remember that. So, the third part is inflammatory. Very easy. Inflammatory is activation and sensitization of nociceptive pain pathway by variety of mediators released at site of tissue inflammation. So, the other important part I want to discuss now is about the mechanism of the pain. The pain mechanism. First, we have peripheral mechanism and we have central mechanism. So, peripheral mechanism is the first of all, pain is acute form, usually reflection of the tissue or damaging stimulus. So there is a transmission system that convey this information to CNS. So this phenomenon is called nociceptive. So we have the first of all peripheral mechanism. The peripheral mechanism, there are specific nerve paths for conducting this sensation pain. So there's receptors in skin and other tissue are nerve terminal, which probably triggered by the chemical stimulus when potential tissue is damage occur. So here we have two type of terminal. One respond to many type of painful stimuli. When the first of all we have mechanical stimuli and we have thermal energy. So there are two major and important fiber which is happen and have the important role in the in sending a pain and feeling the pain sensation, which is first is A delta fiber, second is C fiber. So A delta fiber are larger and transmit the first pain, but C fiber is a small fiber transmit a secondary dull continuous pain. So second part is central sensitization and central mechanism. The central mechanism is a response of the peripheral mechanism. So the nerve fiber are traditionally believed to enter the spinal cord, so through the dorsal root, but it is now seems that many also enter through the ventral root into the spinal cord. So The important thing is that the incoming pain signal in the spinal cord is also modulated by the descending signals from the brain. Okay, so the brain for example, in the anxiety, these pain signals may be augmented or increased. And there is, in addition to this direct path, there is also the diffused sending path known as the spino-reticular tract, which relies too many of basal ganglia in the brain. So, the pain is complicated process that involve the interplay between the number of the important chemical neurotransmitters that found naturally in the brain and spinal cord. These transmit the nerve impulse from one cell to another cell. There are many different neurotransmitters in the body, and some play a role in the human disease and in the case of the pain. One brain chemical of special interest to neuroscientists is the glutamate. So, the other important receptor in the pain transmission are opioid-like receptor like beta, kappa, and delta. Morphine and other drugs work by the blocking these opioid receptors, so blocking the pain. Another type of receptor that respond to the pain stimuli is called nociceptor. There are thin nerve fibers in skin and muscle and other body tissue that, when stimulated, carry the pain signals to spinal cord and brain. So, here we have the body natural painkillers may it prove to be most promising pain relievers. They are serotonin, norepinephrine, and opioid-like chemical like endorphin and enkephalins. So, the mechanism of the pain, we have the major mechanism of the pain, how the pain is transmitted. So I will discuss it in shortly and briefly. So if you see this picture, you will just see it very clearly explain it, how the pathophysiology of the pain is happening, how the pain is signaling. So first of all, in the tissue damage, when there is a tissue damage, the local release of some chemical like prostaglandin, leukotriene, and thromboxane. These chemicals stimulate nociceptors. Nociceptors are small sensory fiber, like we have A delta fiber and we have C fiber. Okay, the A delta fiber is myelinated and very fast. C fiber is unmyelinated, very slow. So A delta fiber, myelinated fast, is sending the message to dorsal column, but C fiber, unmyelinated and slow, sending the signal to ventrolateral column. So after that, sending the signal to the midbrain and thalamus. So midbrain and thalamus. So after that, they send to the cortex. So after this process, recognition and localization and perception of the pain is happening and we feel the pain. So, and some important factor that's influencing the pain sensation, which are nature and severity of the injury and tissue damage, which is very important effect on the signal. So other one is physiological and emotional status of the patient or duration of the injury and neurochemistry and previous experience of the pain and the personality and analgesic consumption. So this is a major important factor that's influencing the pain sensation. Diagnosis of the pain, the self report of the person is the most reliable measure of the pain. To assess intensity, the patient may be asked to locate the pain on the scale 0 to 10, being so in person is non-verbal and cannot self-report the pain. Observation become critical. In such cases, behaves such as indicating the pain and feeling the pain, discomfort will be detected. For characterization of the pain, sharpness of the pain, severity of the pain, onset of the pain, location of the pain, duration of the pain, relieving factor of the pain, we can indicate it by this way. So thank you very much for listening and watching this video. I hope you just enjoyed and benefit from this video, and please don't forget subscribe and like this video. And for making you more video, watch this YouTube channel. I will make a more video about the pain and physiology of the pain. Thank you.